Hi, welcome to Accent Your Beauty. We're so excited that you're here. This is a fun show about cosmetic surgery. After all, everyone wants to look young and beautiful for as long as we can. Not everybody was born beautiful, but most of us could be beautiful, or at least more beautiful, thanks to doctors like Dr. Mark Berkowitz, who's our host here. And we're so happy that you're here to tell us all the latest and greatest things in cosmetic surgery. And tell the audience a little bit about your practice, because you have two offices, correct?
So I have two offices. So one in Sterling Heights, Michigan, and the other in West Bloomfield. And they have a different feel. The one in West Bloomfield, when you come into it, feels more like you're in somebody's living room in their home.
I think we have some pictures that we can show.
I think we do.
Of your offices. And
yes.
That'll make people, now what's that
so
right there?
So this is the reception area in West Bloomfield.
It is like a den or a family room.
Right. So we make it very comfortable for our clients.
And on the TV there, are you able to show different videos of procedures?
So throughout, there's different videos of procedures. There's different segments of when I've been on the news as well, talking about procedures.
That's great for your credibility.
There you go. And it's really terrific information. I actually have made over 180 different YouTube videos on the different procedures as well. So we play those too.
Oh, in the office?
In the office.
Well, that looks pretty comfortable. Now, what are we looking at
So this
here?
is the area in the reception area. If you were sitting in it looking at the reception desk in Sterling Heights.
That's right. It looked familiar to me. That's the office I've been to.
Mm-hmm.
You have a very attractive and nice receptionist there.
She's terrific.
Everybody there I thought was extremely nice and very friendly. And that's where you come in. And again, it looks like an area where people can watch on the screen.
Same videos are playing there. And we actually have in the rooms there videos that if a client's waiting for more than a minute or two, they can put on videos that they select. So if they're interested.
I'm glad you said that minute or two, because that's one of the pet peeves that people have going to doctor's offices is waiting. And I know you pride yourself on customer relations or client relations.
We do.
So you do try to get people in as quickly as possible and not make them wait all day long.
Their time is as important as my time, and so we try to accommodate them as fast as possible. If I can't be there right away, then one of my other staff members is at least with them going through their concerns.
Well, I think the importance of that is that people going to a doctor for a consultation, especially cosmetic surgery, which is elective, they're nervous. They're a little bit scared. What's it going to cost? What's it going to feel like? What's the downtime? So you want them to not have to wait too long and have too much of that anticipation.
Yeah. So we try to take away some of that anticipation as well. So the way my office works is that when you put in for an inquiry, one of my staff members, Maria, who you may have met in the past episode, so she actually will contact you on the phone first, and you'll know all the information, including financial information, before you even come in.
Which is great.
So there's no surprises.
That's great. Now, is that a typical
So this is a typical
room?
Examination room and a treatment room as well. And so the chairs are very comfortable. And I can tell you that as a patient as well, because I've laid down on the table too and had treatments. And what you're looking at is one of our typical rooms where we perform everything from facials to fillers to laser skin resurfacing.
And it's very clean. I've been there and I can tell you, his offices are immaculately clean. And that's important too. When you go into a physician's office and there's boxes all around and the floor looks like it hasn't been washed in a while, it gives you a kind of a queasy feeling about the doctor and his abilities.
Well, safety and sterility are very important. So we want to make sure that everybody has a procedure in the optimum atmosphere.
Well, I think you're definitely doing that. Do we have another picture of the office, interior or exterior, that we can put up?
I think we have the exterior.
Well, maybe not. But anyways, both offices, especially the one in West Bloomfield, is adorable. It's right on Orchard Lake Road, across from Tapper's Jewelers over
That's
there.
correct.
And it's a quaint, cute little office. And obviously you do a lot of business with West Bloomfield, Birmingham, Bloomfield Hills women.
We do, but I can tell you, honestly, we get people from all over the country who come to see us.
Okay, that's a good question. Who is your typical client? Age, gender, ethnicity?
So for the cosmetic world, as far as fillers and Botox and non-surgical procedures, it's around 85% women, 15% men. The ages range from around 20 years old, where young women are first starting to look at lip filler, thank you to the Kardashians.
Okay,
Go
let's
ahead.
talk one thing about lips. I just have to stop you right there.
This is not the Last Wives Club. It's not.
Okay, but doesn't that hurt, needles in the lip? That's such a sensitive area. Don't you think that we should let people know that is a little painful?
So you're correct. It is a sensitive area, but there are tricks to make people very comfortable. So number one, there are creams that could be put on.
That are numbing creams?
That are numbing creams that work extremely well. But if somebody wants to go even further, I can numb the area very much like a dentist does, where I place a block around the area. And
or
then
what about the nitrous oxide? Does that work too?
So we do have the nitrous oxide, but it really can't be used while you're doing the lips at the same time.
because it covers
it's actually,
that area,
They use
right.
it actually in the mouth
Okay.
too, so we don't use
All
it
right.
for lip filler.
Too bad, because that sounds like fun while you're getting your lips
But
bigger.
for other areas on the face and body, we use it.
All right, question about lips. How do you know, a client, not you, when too much is too much? Do you tell your clients, I'm not going above this amount?
So not just for lips, but at many days I feel like a bartender, and I say that
You have
to
to
my
make a
clients.
cocktail, right?
And I just say,
I'm
you know
cutting
what?
you off.
I'm cutting you off. It's time.
Yep.
And so I'm very conservative, and with lips, I only do one vial, one syringe of filler at a time.
And that's for upper and lower.
For upper and lower, I'll split one syringe,
Okay.
let everything, all swelling go down, and then take a look again
reevaluate
at a
it.
month. And if we need to optimize things, we can always add more.
So if someone came in and said, well, I want a whole vial on the top and a whole vial on the bottom, or a whole one on the bottom and half on the top, or whatever, will you do it, or do you wait to see how the first little bit looks?
Well, you know what? Again, a red flag comes up if somebody's telling me exactly what they want,
Then they've done it before and they want more.
or they think they know and they really need the evaluation. And so to show them exactly, what they need. But what the client says is very important, so I take that into consideration for them. So there are people who come in that they have a very thin lip, that at times we will step back and say, yes, for you it does make sense to put more than one syringe in. People don't know what a syringe is, so a syringe of filler is 1/5 of a teaspoon of volume.
That's interesting. I didn't know
Yeah.
that. So it doesn't sound like much. 1/5 of a teaspoon sounds like this much. But when it's spread out inside your lips,
You can get
that could be a lot.
And because of the fact that the lips have such a good blood supply, could be a lot of swelling right afterwards. And so that's why it's better to place one syringe, take a look, let the swelling go down. But for most people, the swelling, is minimal. They may have a day or two where
so
it
if
looks.
you're going somewhere on the weekend,
Yeah.
you don't want to come in on Friday.
Well,
do it.
my favorite is the bride's mother who shows up 2 days before the wedding and says, can you do my lips today? Can you do my filler? And it's not the optimum time to do it right before.
Don't you suggest that people do things like that at least a week before the occasion that they need it? At least a week?
At least a week before, and preferably 2 weeks beforehand, because if you get more swelling than we expect, at least we can do things to bring down the swelling a bit faster for you.
And also, I was told, and you probably agree with this, that if you're on aspirin, a lot of people are on an aspirin every day, you should really cut that off a little bit ahead of any of those procedures so that you don't get extra bruising and swelling.
You have to get the blessing of your medical doctor, because
Right.
sometimes people are on it for a reason with their heart or a
Correct.
stroke, and so filler doesn't take preference over those medical problems.
Right.
But if they can come off of it beforehand, and supplements especially. So people don't realize that many supplements are blood thinners. So most of the ones with G, garlic, ginkgo biloba, cause bleeding.
Oh.
And so when you come
Good to
in,
know.
we have a list of medications that we can give you that we prefer for you to be off, especially before surgery and with filler as well.
Now, aren't there also certain supplements that aid?
Yes,
Like arnica?
arnica and bromelain, which bromelain comes from the pineapple. I tell patients,
Eat pineapple.
Eat that pineapple.
Right? Eat pineapple. No, it is really good for healing.
Right.
But arnica comes in different forms. You can put it on topically. You can take the arnica pills.
Correct.
And it really does
It
help
does
bruising.
help.
What about vitamin E and vitamin K?
So vitamin K is actually something that I do use for patients when they're undergoing liposuction. I have them take vitamin K to stop any kind of bleeding. Other procedures I don't necessarily use it for. Vitamin E I don't really think helps or hurts.
How
for the
about
most
on the
part.
outside, vitamin E? Topically, does it do anything?
I don't think it's worthwhile in any way.
Because it was
They're
very
big.
big for a while.
Yes.
Remember, everybody
Yeah.
said, take vitamin E, your skin will be so glowing and beautiful. Not
Well,
so.
well, now it's vitamin D to take by mouth, and
Oh, I take vitamin D.
Everybody
take
takes
vitamin
vitamin
D.
D. And I hope in a few years we don't find out that vitamin D necessarily didn't have all the studies backing it that it
Well,
should
you know
have.
how everything changes. 1 minute, don't eat red meat, it's terrible. The next time I hear it, eat red meat, it's healthy for you. Those fats are great for your body. It helps you burn fat and
Right.
build muscle.
But only grass-fed.
So, right, and how do you know that unless you see the cow first? But there's so many myths that come and go, old wives' tales
That's
about
right.
these different
Yeah.
procedures. And it's good to ask your doctor. If you've heard something, ask your doctor if it's true. So when we get to fillers and things like that, we're going to talk a little bit about eyes today. We're going to talk about uppers, lowers. We're going to talk about brow lifts, all of which brightens and opens up the area from here up, which is also anti-aging, because one of the first signs of age are bags under the eyes, crow's feet next to the eyes, hanging, drooping eyelids, eyebrows that sag. You can fix all that, can't you?
I can fix all that. I'm excited about talking about it because this is where my background started in oculoplastic surgery. And so today we'll take a look at the latest and greatest and how I can turn back time. The first thing that people see when they look at your face is your eyes. That's the first
It's
thing they
the
look
window
at.
to your soul.
It
There's
is.
a perfect example. People, now in this particular woman here, I see eyelids that need to be lifted. Is that what you see?
That's correct. Yeah. So she has the skin touching upon her eyelashes, and when it touches upon the eyelashes, it begins to block the vision. So at times, a procedure like this can actually be covered by insurance as well. So if there's a blockage of vision, and we show that through a test called a visual field at the office. So what a visual field is, it's a non-invasive test where patients will look at a light. When they see the light, they
Click,
press a button.
Click, click, click. I've had that.
That's right. Then we lift up their eyelid, repeat the test,
And see how much better they see when
see how much
they're
better they
lifted
see.
up.
And
Okay.
so here she is afterwards, and
Much
you can
better,
see
brighter,
her eyes
more open, better shape to the eyes.
better shape to the eyes as well.
And how much post-surgery is that picture about?
So this is about 1 month afterwards, the procedure.
It's pretty quick.
Yeah.
I found that the upper eyelid surgery, which they do in the crease, correct?
So
in
yeah,
that natural crease.
That's correct. So we use the eyelid crease. That's the natural line that's there. And that way, even the incision afterwards should be difficult to see. And it really heals beautifully. Just it becomes the same line as beforehand. And so when people will look at you, they won't know that you had
even
surgery.
without makeup,
Correct.
even without makeup, it's barely visible.
Mm-hmm.
And once you cover it with a little eyeshadow or even a teeny bit of concealer, you can't see it at all. You just look bright and refreshed and younger.
Now I do the procedure in a much different way than many other doctors. So most doctors use a scalpel blade.
Right.
So I put down the scalpel blade 25 years ago.
Really?
And I actually use a laser only for eyelid surgery.
All right. Tell me the difference in the incision when you use the scalpel and when you use the laser. It must make a different incision,
So
correct?
the incision itself heals better with the laser. It also is more precise using the laser. But what makes the laser so important in this procedure is that it helps to stop bleeding at the same time. So in my hands, it's a faster procedure.
So it also cauterizes at the same time?
It cauterizes at the same time.
Oh, dual action. I like that already.
Right.
So that's a lot better.
So it gives more benefit to the patient. It's a faster procedure because I don't have to stop bleeding all the time. And that same laser can be used to contour the fullness or the fatty tissue that's there. So the fullness to the eyelid is fat that we're all born with that comes forward. And you don't want to remove all the fatty tissue because then you have a sunken look to your eyes.
Right.
And that doesn't look very nice.
That's the worst. You don't want that sunken look. So I think the key is obviously the right surgeon, somebody who knows your face, who studied it, and knows exactly how much to take off. Because when you take too much off, I've seen a lot of bad plastic surgery, and you see an eye that's too wide because they've taken too much.
You don't want a deer in the headlights look.
That's the worst. That's what you don't want. So you have to be very careful yourself as you go along to make sure that you're taking off the proper amount for that particular person.
So I actually measure 3 separate times before I remove the skin. So when we're in the waiting area before the procedure, the pre-op area, I do 1 measurement. When I bring them into the operating room, I actually do a pinch of the skin and do a 2nd measurement. And then before we make any incision, there's a 3rd measurement taken.
Does it vary on how tired you are? Because sometimes a tired eye kind of looks a little droopier.
Well, it can. You can get something called ptosis, where the lid droops, and that can be from somebody being tired, but it could just be, naturally that they're holding up their eyelid with their brow. And the brow is actually heavy, and as the brow falls throughout the day, their eyelid falls with it. It keeps coming down.
This is all great. I'm loving it, and I hope everybody else is learning a lot. We're going to be right back and talk about the lower lid area.
If you need a fingerprinting service, A1 Fingerprints is the place to go. A1 Fingerprints specializes in fingerprinting for teachers, students, law enforcement, and more. A1 makes the process so easy and simple you can be in and out in 10 minutes. A1 does walk-ins, so appointments aren't necessary. A1 Fingerprints, located in Southfield on Southfield Road. Go to a1fingerprints.com for more information. That's a1fingerprints.com. It's that easy.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on new radio media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
At Murray's Part City, we're known for offering customer service you won't get in any chain store or online. But don't take it from me, just listen to what our customers have to say.
The employees at Murray's are knowledgeable, courteous.
They make you feel like you're at home.
Pick up a can of Seafoam Fuel System treatment for only $6.99 or a 5-quart container of Mobil 1 motor oil for just $28.95. Murray's Part City and Pontiac Trail at Maple Road in Walled Lake.
We've got the parts you need when you need them.
Working for New Year's ties, kinda how I've been living. Feeling all a little deflated, kinda how I've been rolling. Going till my steel belt showing, never slowing to rest much. Driving around the streets until they come to detest us.
Welcome back. I hope you're having fun learning about how to look younger and more beautiful, which is what we're here to help you do, at least to get enough information to make an educated decision of whether or not cosmetic surgery is for you. And for most of us, it's a godsend. I mean, you want to look good for your age, you're going to need a little help. Mother Nature and Father Time, not always on your side. So we're going to go back to talking about eyelid surgery because that's really essential. Eyes are the window to the soul, but they're also a window to how old you are. You can tell a lot by a person's eyes. And uppers, we know how we can fix that with that laser cut above, tightening and brightening and opening. What about under the eye? Because that's an area that is of more concern to most women because you either get one of two things as you get older. You either get puffiness and bags under your eyes, or you get sunken in that like well underneath your eye. Is that based on bone structure?
So it is based
and how much fluid you
and
retain?
there's also ligaments in the area. So an area that many people are hearing about now is something called the tear trough. So the tear trough is called that because it was originally described as your tears would flow down that little valleyway. And so that comes about from a ligament that is underneath the eyelid, and basically by the fatty tissue in the cheek pulling down, it makes that ligament pull as well, creating this valley. And so that's something that can be treated surgically by using the fat from the lower lid and redepositing it in that area of the tear trough.
Which lasts longer than putting a filler in there,
Which lasts
correct?
longer than putting filler,
Because
that's
it's
correct.
your own natural fat.
Right. Or for some people, will actually take fat from other parts of their body, use it as a filler into that area as well.
Now, can you also add those blood platelets that you do
So
in a blood facial? Can you use that as well?
So PRP or platelet-rich plasma can be used in the lower lid area, but I do like using it still with a little bit of filler. So the PRP can help to tighten the skin, improve the skin tone in the area, but you still need a bit of volume within that area too, and the PRP alone probably won't give all that volume.
Well, it probably takes a good doctor to know that blend. It's like a cocktail. How much of the blood, how much of the filler, and do they go in together? Do you mix them, and do they go in through the same needle or two separate needles?
No, actually it's separate. So I'll place the filler first, and then I'll place the PRP or platelet-rich plasma second, and use that really, for most people, I use it throughout the face. When I look at somebody, even if they're there just for, they're pointing to the nasolabial fold or one line, I take a look at the entire face and put a plan together for them. So this lovely lady, she was bothered by her upper eyelids as well as her lower lids, and she was bothered by the skin coming down and sitting upon the eyelashes and the fullness to the lower lid as well. And I used the laser to sculpt the upper eyelids at the eyelid crease, remove some of the excess skin that's there and contour the fatty tissue. And then the same laser, there is no skin incision at all, no stitches, no scalpel blade. I use that laser on the inside of the eyelid and using it for the lower lid.
Now, I'm interested that you said that because the way it used to be done was they would make a small incision along the lash line, and that would be how they would raise that lower lid. And they don't do that from the outside anymore?
Well, there's they and there's me.
Okay, so you don't do that, right?
So on occasion, on a rare occasion, I will, but I find with my hands and the laser that I use, I get great results by using the laser on the inside without having to make any skin incision at all. The beauty of not making that skin incision is that on some people, that skin incision, number one, there's nowhere to hide it like on the upper eyelid. The upper eyelid, that skin incision is hidden at the crease.
The crease, right.
The lower lid, there's no place to hide it. So that line can show through. And if it spreads the scar, then it can become an unsightly line that's there as well.
It becomes like that red ropey line that's very hard to conceal even with eye makeup.
Right.
So you want to avoid that.
You want to avoid that. And so this avoids that altogether. And you may have seen pictures of, there are some stars who are well known who had surgery that way that actually disappeared for a while, and that's because it took surgeons like myself to actually remove skin from behind their ear to put it into their eyelid to lift the eyelid back up, and that's something you want to avoid.
It's like botched surgery, and there's a lot of it, and they probably come to you to have you fix things that other doctors mess up.
I see quite a few, well, I don't want to call it mess up. Sometimes people just don't heal the way we
doctors mess up too, let's be honest. Not you, but that's why they come to you, to correct.
So I do a lot of corrective procedures for patients, and we take care of all clients, but somebody who's already been through a procedure, it takes a lot of hand-holding to get them through and help them to correct things.
Well, you're nervous to try it again if what you've had before didn't work, or you see lower lids that droop. You see the ones that kind of droop in the corner, or when you close the eyes, they don't
fully close
all the way anymore. That's scary. So when you see that, you're a little nervous. What non-surgical things can you do under the eye?
So under the eyes,
injections.
there are injections with
and there's
filler.
fat sucked out, correct?
Right, and so with the injections, so we can use filler, and you have to use the right filler because otherwise you can end up with this effect called a Tyndall effect.
And you look blue under the eye.
where you have blue under the eyes.
Correct.
And so there are fillers that are made specifically to help with the lower lids to build them up. And I'm very conservative. So first of all, I don't use a needle in that area. I use a cannula. A cannula is something that's not sharp. And
Well, isn't that what they use in a bigger size for liposuction?
for liposuction in a much bigger size.
Way bigger. That one's like a vacuum cleaner, and this is like teeny,
this
teeny.
is teeny, less than a millimeter, and it allows me to place the filler without a sharp needle within the area.
Now, is that less painful?
So patients are usually actually surprisingly comfortable with lower lid filler.
Now, what's the best filler for lower lids? Because we're going to do a whole show on fillers.
Yeah.
Fillers are the best. Love them. But there's different. There's Perlene, and there's Radius, and there's Versa, and there's, Restylane.
So there's a family of fillers called hyaluronic acid. So hyaluronic acid is actually found within the body itself. And so you have it in your joints as well. And so from that hyaluronic acid, there's a few different fillers. So people may have heard of Juvederm or Voluma.
Of course.
Well, there's one filler made by the same company, Allergan, called Volbella, that works very well within the lower lid.
What's it called again?
Volbella.
V-O.
Volbella.
Volbella. Okay,
And
write
then-
that down, ladies.
And the
Okay.
other one is another Bellotero. Bellotero is another one that's very nice
I thought
for
I
lower
knew
lids.
so much about fillers, and I'm learning so much now. I'll
Good-
be in to
good.
see you real soon. So these are made specifically for under the eye, so you don't get the blue tint.
So you should not get the
And-
blue tinge with
And it's
that.
a tiny needle for under the eye, correct?
Correct. Yeah.
So you don't have to worry
So
about it.
actually not a needle at all. I'm using that cannula, so you
So
don't
it's
have
even better.
even better.
Less
yeah.
painful.
Yeah.
What does it cost? We didn't talk about the uppers. What a typical upper lid costs. What's the typical?
So when we give pricing in my office, we give pricing for everything. And what that means is the pre-op, the post-op, and the operating room. So while other doctors may perform it in like the room you saw before where I do fillers, I only perform eyelid surgery in a certified operating room, which we have in our Sterling Heights office with board-certified anesthesiologists.
Well, that's so important right there. That's the most important right there.
Because
People are afraid of anesthesia.
yeah, we want to make sure that the patient is comfortable, that it's done in a sterile environment for them, and that if at some point somebody says, maybe I'm feeling something I don't want to, I'd like to be more asleep, they could be put more to sleep.
Right.
So they dictate how comfortable they want to be. If they want to be fully asleep, they can be fully asleep during the procedure.
So including the
So including
anesthesia,
everything,
the consulting, the procedure,
It runs
aftercare.
around $4,000 for upper eyelids, around $7,000 for both upper and lower eyelids. To the combination of the two.
Okay. What's the downtime if you're doing just the upper? What are you down, a week? If that?
So I like people to be at home 7 days after upper and lower eyelid surgery. With the lower lids, if we can go back to the picture of the lady afterwards, that lady had lower lid surgery, and you'll notice that her skin is rosy afterwards. Because when I use the laser on the skin to help tighten the skin, and we can go back even one before, and you'll see what her eyelids looked like before. You'll see she had a lot of wrinkling to the skin. And then we go to the after, you'll see that skin is nice and smooth, and she's got this peaches and cream look to it.
It's almost like new baby skin.
It's new baby skin.
Which is so what we all want, right?
And so this same laser I use on the entire face. So I can use it on the entire face to help smooth the skin as well. And so it is just beautiful how we can smooth that area and improve the skin.
Now, without surgery, when you have bags under your eyes, without having them surgically removed, is there anything you can do before you get to surgery that will help reduce that?
So there are procedures, but they're not great to help reduce them.
So you can fill in a lot easier than take out.
Right. So even like using this laser, if somebody said they didn't want the fat removed, but I use this laser on their skin, I like to think of it almost as if somebody has to make their bed quick and they left the pillow in, and then they take the blanket and they push everything down. Well, we can do that with the laser. We can push that fat down. So not the same degree as removing the fat, but we can make a nice change for them just by using the laser on their skin.
So some people don't necessarily need both. One procedure, if you do it properly, can really alleviate both,
depending upon what they're looking at. But many people need both the lines gone, the skin tightened, as well as the fullness decreased. And we don't necessarily remove all of the fatty tissue. Again, it can be transposed, some of that fatty tissue, into the tear trough area.
Well, if you take too much out, I've seen women who actually look hollow under. And when you look hollow, you look older.
You look older.
So
definitely.
you're defeating the purpose. You want to look younger. You take out too much, now you look older. So again, it's about the doctor you choose. And that's why we love Dr. Berkowitz, because he'll make you look gorgeous. And you're not overpriced. You're not like one of those Beverly Hills doctors that charge an arm and a leg. And we're going to be back and talk to you about brow lifts.
If you need a fingerprinting service, A1 Fingerprints is the place to go. A1 Fingerprints specializes in fingerprinting for teachers, students, law enforcement, and more. A1 makes the process so easy and simple you can be in and out in 10 minutes. A1 does walk-ins so appointments aren't necessary. A1 Fingerprints, located in Southfield on Southfield Road. Go to a1fingerprints.com for more information. That's a1fingerprints.com. It's that easy.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on new radio media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
At Murray's Part City, we're known for offering customer service you won't get in any chain store or online. But don't take it from me, just listen to what our customers have to say.
The employees at Murray's are knowledgeable, courteous.
They make you feel like you're at home.
Pick up a can of Seafoam Fuel System treatment for only $6.99 or a 5-quart container of Mobil 1 motor oil for just $28.95. Murray's Part City and Pontiac Trail at Maple Road in Walled Lake.
We've got the parts you need when you need them.
Working for New Year's ties, kinda how I've been living. Feeling all a little deflated, kinda how I've been rolling. Going till my steel belt showing, never slowing to rest much. Driving round the streets until they come to detest us.
We have a little added surprise for you. Before we get started talking about brow lifts, we actually have a video. And I must say ahead of time, if you're a little squeamish, you might not be comfortable watching this, but we're going to show you some eyelid surgery. And Dr. Berkowitz will explain to you what he's doing as we go along. So if you're squeamish, you might want to look away. But if you're like me and you're curious, you're going to enjoy watching this.
So what you're looking at is, this is the laser in my hand, and I'm using the laser to make the incision. And the red mark that's there is actually an aiming beam. And so it helps me to be precise. And you can see I'm coming around and it's stopping the bleeding at the same time. And so this is upper eyelid surgery. The patient has no discomfort during this. The area is already frozen, and there's actually underneath the eyelid a shield to protect the eye throughout. So there's no chance of harming the eye during the procedure.
So you don't really even touch the eye.
No, not at all. And so I'm removing that excess skin now using the laser. And you can see how dry the area is. So there's no bleeding.
And that strip that you're removing is the excess.
So that's excess skin, and it's also a little bit of the muscle as well. So when people look at the eyelids, they don't realize it's actually several different layers that we're going after. And then here I am, and I'm using the laser, and what I'm doing is going after some of the fatty tissue that's in the pocket there.
Okay, so that kind of yellowy,
Right. That's
creamy
fat.
colored stuff is fat.
That's fat.
Okay.
Sorry about the camera work there.
Somebody needs to steady. Hold on. Okay, so now you're taking out those little
So a little bit of the
fats.
fatty tissue that's
Okay.
there, that's the yellow that's there. And the laser, I'm now actually contouring the fat without removing it, and I was using the laser to do that.
Okay. And somebody's actually assisting you holding that lid.
So holding the lid
Open for you.
down, and that actually, what that does is, number one, keeps that shield in
That's more
place.
fat right there?
That's more fat.
Okay.
And the other thing it does is, before I said the eyelid's many different layers, one layer is called a levator. It's thinner than a one-ply tissue. And with the levator, what ends up happening, we don't want to touch that because that's lifting up the eyelid. And by
Okay.
placing the eyelid on stretch, that helps to alleviate that. And here I am placing the stitches in place for the upper eyelid. And that's it.
So that's how it's done. Simple, easy. It wasn't so graphic. I think it was interesting to see how it's done. And then afterwards, you have that nice, tight look in your upper eyelid, wide awake and bright, but not a deer in
Not in deer
headlights.
headlights,
Just
no.
bright. Okay, so now we're going to talk about brow lifts. Now that's an area that I think is very touch and go. You have to have the right doctor for a brow lift, because talk about a deer in headlights. If you get too tight a brow lift, whew, not a pretty look, correct?
That's correct. And again, sometimes when people will come to me after seeing other doctors, and they say, Dr. Berkowitz, I'm coming to you because I want to have eyelid surgery, and I was booked with another doctor, when can I do it? I say, slow down, let's take a look at the whole area. And more times than not, their brow is actually pressing down. And if you don't do anything about the brow and you just remove the excess skin that's there from the eyelid, you can actually pull the brow down further. And then they'll look at themselves and they'll say, I think I look better, but something.
So do you do a combination sometimes?
So many times I'll do the brow along with the upper eyelid.
Okay.
And upper and lower lid sometimes
Now
too.
explain what you do with the brow lift, because you don't cut the brow and lift it. It's not that.
Yeah.
You make incisions up in the hairline,
Yeah.
and then lift from there.
So many people are fearful of brow lifts because they hear of these horror stories from years past, and some doctors still may perform it where there's an incision that goes from ear
Oh,
to
I know.
ear.
That's
Right?
horrible. They
Right.
don't do that anymore, do they?
No, some doctors still do that. It's called a coronal brow lift.
Awful.
The problem with that, even though it lifts the brow, is that through that whole area there are nerves,
And
and
your
they're
hair
cutting
doesn't grow
nerves.
back, right?
You lose hair within that area. You have numbness to that area as
awful,
well.
yeah.
And so I avoid that. I do a procedure using an endoscope. An endoscope's like a camera. So many people may know an endoscope from gallbladder surgery, from surgery on the stomach itself.
And they use endoscopic surgery for mid-face lifts
They
as
do.
well.
And
So I
that's
know
correct.
it's a very helpful little tool to
It is.
have.
It is. And so what that allows me to do is to make 4 tiny incisions. So there's 1, 2 over each ear, and then 2 in the hairline. And then using the endoscope, I find the muscles that are pulling the brow down, and I relax them. Actually, even before that, I will place Botox for patients. And the reason I do that first, before the procedure, is I want those muscles not to be pulling as hard after the procedure.
That's very smart. Not every doctor does that, do
Right.
they?
Not every doctor does that, and I do that with many procedures, even facelifts as well.
I like that.
Because I want to make it that those muscles are a bit weaker after the procedure, because I don't want them pulling so hard afterwards. So then when I'm in the operating room and I relax those muscles, I then lift up the entire area, and through the tiny incisions in the area here, I actually place like a tack, if you will. You can almost think of it as a carpet tack. And I lift the brow to where I want, and I tack it in place. The tack, it dissolves all on its own. It takes a few months to dissolve, but once it's dissolved, you don't have to worry about the brow
Now, is there
falling back down.
bruising with the brow lift? Where would you bruise?
So with any procedure where you make an incision, there's possibility of bruising.
Would that be where the incisions are?
Well, you can, but due to gravity, it's more likely you can end up with swelling in the lower lid area.
So you look kind of like you have a black eye?
Yeah, but we usually don't get much swelling with it. Again, I use some cauterization as well, and at times I can use the laser too, and I usually don't get much swelling. Also, the type of anesthesia that I use, so when I inject that area, and again, you're asleep during that, you're not feeling that, that type of anesthesia is the same type of anesthesia that I use when I'm doing liposuction. So basically, it kind of balloons up the area, so it helps to stop bleeding within the area at the same time.
Is that like what they do when they're suturing a cut and they inject it so it puffs up a little bit while you're doing it?
That can help with that too, yes.
That's great to know. See, now you demystify it. It's not as horrible sounding as people think. Is a brow lift painful? Is there pain involved with that?
Again, I only perform it in the operating room with a board-certified anesthesiologist, so you're made comfortable during the procedure.
Afterwards.
The type of procedure that I do with that anesthesia will last hours after, too,
So for the
comfort.
first 24 hours, you're pretty comfortable.
Yeah, most of my patients don't need anything more than Tylenol, with even facelifts when I perform it.
I can attest to that. Yes.
So it's rare that you need anything more than that.
All right, because I think brow lifts are something that people look at as an option to a full facelift. When they just want to brighten their appearance, they look at a brow lift, at least for the upper face.
So this lady, if we go back to before, and then we'll show her after again. So if we didn't do anything about her brow, and we just removed the excess skin for her, her brow would have fallen further. And then let's go to the after. And so here she's having upper eyelid surgery as well as the brow lift for her. And again, we're not trying to raise that brow an inch.
You don't want to look surprised every time
it's
someone
more to
looks at you.
stabilize it than anything else. And you can. It also helps with the crow's feet area as well by lifting that brow.
Now, does it help under the eye at all when you lift?
So it helps with the crow's feet. The lower lid area probably won't change those lines. And this lady, I can see some rosiness to her skin afterwards. So that tells me that I also resurfaced her lower lids, and that's what helped with her lower lids. And I used that laser on her skin.
What's the cost on a brow lift?
So a brow lift alone runs around $5,000, but when it's combined with eyelid surgery, I believe the price drops to around $3,500.
Really?
Mm-hmm.
Wow, that's affordable for most people.
Mm-hmm.
Now, is there ever any kind of medical condition where insurance will cover that?
So it's interesting. So if your vision is blocked, again, you can have a visual field test just like with eyelid surgery. And if it's found that it's blocked for you, insurance may cover it for you. They look at other parameters too, both for eyelid surgery as well as the brow. The whole thing is they don't pay for the cosmetic procedures. So the procedure to hide the incisions,
right,
they're not paying for that. What they pay for is an incision directly over the brow where I remove some of the excess skin and muscle and place stitches over the area. It leaves a scar.
I don't think it's worth getting the insurance to cover it if the results aren't as good.
Yeah, I don't want my name on anybody who's going to look like Frankenstein afterwards.
Well, I'm sure your clients do not walk out of there looking all stitched up like Frankenstein. But the cost seems to be affordable for these procedures. And what is the downtime on a brow lift? I know you mentioned 7 days.
So same thing for a brow lift, seven days time. If somebody's doing a brow lift, upper and lower lids, I like them to take 10 days time. More for the lower lid area, because with the lower lid area with the resurfacing, I don't normally get them in makeup before 7 days. And people usually want to be able to wear makeup to go back
right
to work.
Away.
Right?
That's the first thing is, when can I wear makeup?
And there are some better makeups now that you can get people in earlier, but my preference is...
Are they hypoallergenic?
They're hypoallergenic.
So
they
you
actually
don't have to worry about infecting that area.
They help in the healing too. They allow oxygenation to the skin. And so there are some very good products, but to be safe, I say 7 to 10 days.
Before you can put on makeup.
Yes.
So just get some really good sunglasses and wear them 24 hours a day whenever you're out anywhere.
Well, I still want them to wear good sunglasses anyway, because again, if I'm resurfacing their skin, I want them to protect their skin, not just with sunblock, but with good sunglasses too.
Well, since it is summer and it has been unseasonably hot, let's talk a little bit about the sun and how that affects not just eyelid surgery in that eye area, which it's smart to always wear sunglasses anyways. But how does the sun damage that area?
So there's UVA and UVB rays, and there are others too, but those are the two main ones that people know. So the way I like for people to remember it is UVB are the bad rays that can cause cancers. UVA rays, those rays are aging, the A's for aging, and can age the skin. And so what ends up happening is there's different kinds of collagen within your skin. It breaks down the collagen. There's loss of elastin to the skin as well. And there's just an overall breakdown to the skin over time for people. Even if they don't end up with a skin cancer, that's what causes the aging, is this loss of elasticity and change of collagen.
Well, I mean, just think about a turkey. Before you put it in the oven, you can kind of pick up the skin. It's supple. You can touch it. After it's been in there for a while, it's dried up, it's brown, it's thin. Your skin's the same thing.
Yeah,
it's
so
an organ, and you have to take care of it.
So you have to protect it, and so sunblock every day is very important. There's some great sunblocks that are out there now. You don't have to worry about wearing a white mask, you know, the zinc of the
remember
past.
We used to put the zinc everywhere. But I think another factor that people should remember, especially women, men too, because they have eyelid surgery, just I'm sure like women do, but you squint when you're in the sun. And then when you squint and the sun hits the outer areas but not inside those little fine lines, then they show more.
Not only that, people don't usually place sunblock on their lower lids. It's an area that they forget about, and that's why the eyelids, any kind of lump or bump around the eyelid, has to be looked at for skin cancer. It's notorious for that.
Well, it's interesting to know because skin cancer is so prevalent, and it is avoidable if you stay out of the sun or wear a lot of sunscreen. And hopefully parents today are smarter than my parents were, and we've learned that sunscreen is essential. Anyways, we will be back to wrap up and finish our talk about upper, lowers, and brow lifts.
Tarno knows doors. We've got garage doors, entry doors, storm doors, custom doors. Tarno knows doors.
Plus, the latest LiftMaster garage door openers and the toughest retractable screens on the market, all by the push of a button. Tarno Doors is celebrating its 50th year anniversary and is the recipient of the 2016 Subcontractor of the Year from the Home Builders Association.
Tarno knows doors. Tarno knows doors.
Maple Lane Golf Club is a 54-hole golfing treasure located in the heart of Sterling Heights. Maple Lane Golf Club offers immaculate greens, a top-flight pro shop, and inexpensive green fees. For convenience, book your tee time online at maplelanegolf.com. Come out and enjoy a great golf experience. Try our 9 and Dine special, 9 holes of golf, and enjoy food and refreshments in the Clubhouse Bistro. That's Maple Lane Golf Club in Sterling Heights. Check us out at maplelanegolf.com.
The brain naturally shrinks as you go older. Now there's research that indicates that the rate of shrinkage increases if you drink alcohol. Your brain volume naturally decreases by about 2% for every decade you live. And in the past, scientists have speculated this rate could be slowed with moderate alcohol intake because it appears to improve your heart function and your blood flow. But now, however, the U.S. researchers have found what they call a significant negative relationship between the amount of alcohol that you consume and your brain volume. A study involving nearly 2,000 men and women found a significant difference in the brain volumes of people who were moderate drinkers and those who were teetotalers. And the association was especially strong in women. So the bottom line, say the experts, is that while moderate alcohol consumption may help your heart and blood flow, it offers no protective effect on your brain volume. With another prescription for your health, I'm Dr. Jim Bragman.
Well, now that we know what some of your alternatives are, and your anti-aging tricks to looking bright and refreshed, we're going to talk a little bit more about some of the options that you have that are non-surgical for people that are either afraid to go under anesthesia, don't have the money for surgery. Tell me some more things you can do that are non-surgical.
So radio frequency has been around for a while, and what radio frequency is, you can think of it as the same radio waves you listen to. When placed in the proper technology, creates heat. And what that heat does is actually builds collagen for
Like
you.
Thermage, for example.
Like Thermage. So we offer 3 different types of radio frequency. One is called Thermage, which has been around for over a decade now. One is called Exilus, and the other is called Venus Viva. And they all work a little bit differently. The beauty of a treatment like Thermage is Thermage can be used one time to help tighten the lower lid area, can be used on the upper eyelid area, can be used to lift the brow as well. It's not the same as surgery. So it's more for a younger person to make those changes. But there are some people who come to me who are a bit older who say, I understand, but I'm not ready for surgery. Will I get changes? And if I believe that they can get changes, then we can move forward with a procedure like that.
Well, I think something that people should know about these procedures like Thermage is you don't get instant gratification. You
That's
don't
correct.
see it the second you walk out of the office. So if you expect that, you're going to be disappointed.
Yeah.
Look in the mirror and say, but it looks the same.
Yeah, these are progressive
takes
treatments.
time.
And then why it takes time is we're building collagen, and
And
collagen
it has
doesn't
to
build
regrow.
overnight.
So it can take up to 6 months to see full results, correct?
That's correct, yeah. Some people may see it as early as 12 weeks time, 3 months, but 3 to 6 months to see results with these tightening procedures. And Thermage can be used on the entire face. It can actually be used on the body too for tightening as well.
How about on the neck area? Does Thermage work?
So Thermage can be used on the neck area. There are other procedures I like better for the neck area. I actually use a laser through tiny incisions, one underneath the chin and 2 by the ears. And I use the laser underneath the skin to get tightening of the neck and
Now,
melt the fatty tissue.
Does that cause bruising of that area externally?
So again, anytime I make an incision, there's a
gonna
chance.
be
There's a
bruising.
chance.
Possibly.
But
get your arnica.
yeah, but the audience can go to my YouTube channel and they can see people that have had the procedure. I have a volleyball coach who went back to coaching the next day, and so I don't recommend that.
So what's the typical downtime for that procedure with a little incision here and here? Now, are those dissolvable, or there's no stitches
There's
at
no
all?
stitches at all.
Even better.
And that's 2 to 3 days time that I tell people I want them at home. A procedure like Thermage, when we're doing that, there's no downtime. They may have redness for an hour or 2 afterwards. The treatment Venus Viva is also a way to tighten, but compared to Thermage, I do multiple treatments with that, but that also has the benefit of that it improves the skin tone and the color of the skin at the same time.
texture as well?
So that's the
That's a
beauty of
winner.
a procedure like Venus Viva.
What's the cost for Thermage and the procedures like that?
So Thermage for a single treatment runs as low as $1,000 and up to around $2,500, depending upon the area that we're doing.
Do you often have to repeat that?
So Thermage is a treatment that many people will do once and see results. Some people will do it a second time around 6 to 12 weeks later, and that just enhances the results.
So that's like maintenance.
Correct. A procedure like Venus Viva or Exilus will usually do around 3 to 5 treatments, depending on what we're doing, usually a month apart, and then people would come in maybe once every 6 months to a year to maintain those findings.
And the one where you make the injection here and behind the ears, what's the price on that one? That sounds like it might cost a little more.
So that runs around $4,500, and then I can combine it with other things. So I can combine it with a special laser underneath the skin, besides the laser that melts the fat, but one that tightens the skin. And I can also combine it with a stitch that's like a trampoline stitch that goes back and forth and underneath the chin and along the jawline to define the jawline for them. And so that starts at $4,500.
And what's the downtime on that?
So I tell people that I want them at home a week with a procedure like that, but for most people, they're feeling great in 2 or 3 days' time.
They're ready to go.
Yeah.
I mean, if you do have any tenderness, you can always wear a scarf, right? Or camouflage it any way that you want to still go out.
Yeah, 99% of the times it's easily camouflaged. There's very little swelling.
Because staying in for 7 days for some of us is a little hard.
It's hard.
And besides, there's nothing to be ashamed of. I tell girls, I see them with the big sunglasses on, with the big scarves after a facelift, and I always go, you go for it, honey, because there's no shame in it anymore, is there?
It's funny, we laugh when people come in of happiness on the hats that people pick. People pick some beautiful hats to hide out underneath.
You know what? You don't have to hide out anymore. You should be proud of it. It just shows that you value yourself, you love yourself, and you want to be the best you could be. You want to look the best and feel the best. And I always say, when you look great, you feel great. Don't you agree?
It is true. You can see, again, when people come in before a procedure, and then you see how their face changes, not just from what I've done, but the smiles that come about.
And the best part, the compliments. When people come up to you and say, I don't know what you did. Did you change your hair? Did you lose weight? But you look fabulous. Isn't that the best
But that's it.
reward?
And again, I love hearing that. I don't know what you've done. Because if they've known that, then there's something
it defeats the purpose.
That's right.
If they say, you had a facelift, that's bad. But if they say, what did you do? Did you cut your hair? Did you lose weight?
Is it a new diet?
The best. I know. That's the best. And if you pick the right doctor, like Dr. Berkowitz, you will come out looking refreshed, and hopefully no one will know what you did unless you choose to tell them. And there's no shame in your game if you look 10 years younger. So we'll be back with more tips, more education, and more exciting stories about facelift and other procedures, success stories. Thank you, Dr. Berkowitz.
Thank you, Jackie.